Buenos días. Yo veo que hay personas que continúan entrando en la sala. Esperamos un poco para empezar. Good morning. I see that there are still people entering the webinar. I will wait a little bit before we start. Okay. Good morning and welcome to today's webinar, World Suicide Prevention Day 2024, Change the Narrative. I'm Renato Oliveira Souza, Chief of the Mental Health and Substance Use Unit at the Pan American Health Organization, and it is my pleasure to welcome everyone joining us via Zoom. I'd like to remind you that simultaneous interpretation is available in English and Spanish. To activate translation, click on the globe icon on the bottom of your screen and choose your preferred language. Me gustaría recordarles que contamos con interpretación simultánea en
And he's
inglés
repeating
y
that
español.
we have
Para activar
interpretation.
la traducción, hagan
He's
clic
saying it in
en el
Spanish just
icono
in
del
case.
globo terráqueo que se encuentra en la parte inferior de su pantalla y seleccionen el idioma de su preferencia. Before starting, allow me to give a very special thank you to the University of Toronto, our partner in the work we do on suicide prevention and in this series of webinars. Also, a big thank you to our wonderful presenters. World Suicide Prevention Day, which is commemorated annually on September 10th, is an important opportunity to bring much needed visibility and awareness to the issue of suicide, emphasizing that suicides can be prevented. The theme of World Suicide Prevention Day for the years 2024 through 2026, Change the Narrative, aims to inspire open and honest discussions about suicide and suicidal behavior to break down barriers, raise awareness, and create a culture of understanding and support. This will be the first of a series of webinars jointly organized by PAHO and the University of Toronto that address the topic of changing the narrative for suicide in this region. Please look out for more information on the next webinar, which will take place later this year. Suicide is a significant public health concern for the region of the Americas, where rates in many countries remain high or have increased. The Americas was the only WHO region to show a rise in suicide rate between 2000 and 2019, climbing 17%. While the magnitude of the problem is alarming, we do have evidence-based interventions, such as those outlined by the World Health Organization Live Life Implementation Guide for Suicide Prevention in countries, which, when properly implemented, have been shown to reduce suicide rates. Among these effective interventions is responsible reporting on suicide by the media, who play a crucial role in changing the narrative to prevent suicide in the Americas. Today, we'll hear from three experts from our region in the field of suicide prevention research, mental health policy, and journalism. Following all of the presentations, we will have time for questions and answers. We encourage you to use the question and answer or chat box to share your questions at any time during the webinar. And now, it's my pleasure to introduce our first presenter, Dr. Mark Sinyor. Dr. Sinyor is a psychiatrist at Sunnybrook Health Science Center and associate professor at the University of Toronto, He's regional lead for the International Association for Suicide Prevention's Partnerships for Life initiative in the Americas. He's lead author of the Canadian Psychiatric Association recommendations for responsible media reporting about suicide. Mark, it's a great pleasure to have you with us. The floor is yours.
Thank you so much, Renato. I'm going to share my screen, and while I'm doing that, just to say what an honor it is to be with you and to be with this, the whole region and the whole group on such an important day. And also a thank you from the University of Toronto to PAHO for organizing the series together. We hope it will be a wonderful, we know it will be a wonderful series. As mentioned, I'm going to focus on talking about changing the narrative, and particularly about two ideas called Werther and Papagano effects, which I will explain in a moment. So I wanted to start with a few quotes. No fact is better established in science than that suicide and murder may perhaps be added is often committed from imitation. Now, we don't use the word committed to talk about suicide anymore because it evokes the historical criminality of suicide. And thankfully, most countries in our region don't have suicide is decriminalized. It's important that that's true in every country. But we can forgive William Farr for not knowing the modern nomenclature in 1841. William Farr was one of the progenitors of epidemiology, which is the studies of population level health events. And just after he wrote that quote, a few years later, there was this one, that suicides are alarmingly frequent in this country, and this was referring to the United States, is evident to all, and as a means of prevention, we respectfully suggest the propriety of not publishing details of such occurrences. And this came out, again, an old nomenclature in the American Journal of Insanity, which is now the American Journal of Psychiatry. But this came out in 1845. The idea that we have to be cautious about how we talk about suicide was known almost 200 years ago. Just for reference, Darwin's Origin of Species came out about a decade and a half after the second quote here. So this is not new knowledge, this is old knowledge. And I want to read you another quote, which I spend a lot of time thinking about. An idea is like a virus, resilient, highly contagious, and an idea can grow. The smallest seed of an idea can grow to define or destroy your world, a simple little thought that changes everything. This is a quote that comes from the movie Inception. I don't know if many of the viewers are fans of Christopher Nolan, who won the Oscar this year for Oppenheimer. And people remember this particular movie for science fiction and dreams within dreams. But if you've seen it, you may not remember that the main conflict of the film is that the main character, Cobb, has put an idea in his wife's mind. And the idea is that she should die by suicide. And it's a bit convoluted, but the intention behind it was good. He was trying to help her escape from a dream. But the problem is, after she escapes from the dream, the idea stays and she dies by suicide in real life. And I spend a lot of time thinking in my work and my life about inception and how, the ideas that we put in people's minds and what those can be and should be. And that's really going to be the focus of what I'm going to talk to you for the next 15 minutes or so about. Lastly, this is a quote from a patient. I work here at Sunnybrook Health Sciences Centre in Toronto, Canada. It's one of the largest teaching hospitals in Canada, and we have trainees and residents. And a few years ago, one of my residents was interviewing a patient who had had episodic depressions over the course of a number of decades, and asked the person, as we always do, have you ever thought about ending your life? And the patient replied, I've never thought about suicide until 3 or 4 years ago, because now it's all the news talks about. So we have to think about this idea of suicide-related communication and how it affects society and how it affects our understanding. As Renato mentioned at the beginning, the WHO's Live Life Implementation Guide lists 4 different areas of focus, key evidence-based interventions for suicide prevention at a population level. And today we're going to focus on this idea of interacting with the media, although I would argue we need to actually broaden that to think about just how we message about suicide across society. Especially since this is an inaugural event of World Suicide Prevention Day event, I want to make sure that we're all on the same page and just to think about how suicide arises. And this is the integrated motivational volitional model of suicide by Rory O'Connor and Olivia Kirtley. And it takes you through how suicide happens, starting with a person's predisposition, which is biological and genetic, but also environmental and based on events that occur to them. And then the idea is that people who are suicidal experience some kind of defeat and humiliation or humiliation. And if they're not very good at solving problems or may have limited coping strategies, they may feel stuck. Probably the most important thing to understand about suicide is that suicide does not occur if people feel there are a lot of options. People die by suicide when they feel trapped and they feel stuck. And if someone feels stuck, and perhaps they feel like they don't belong or that they're a burden on others, which of course is really never true, and maybe if they have limited goals, they might start thinking very seriously about suicide. And then we spend a lot of time as researchers thinking about the transition from suicidal thinking to suicidal behavior. And there are a number of different factors that can influence that, such as access to the means of suicide. But one of them is just how we think about suicide as a culture and how we think about appropriate ways of behaving or culturally acceptable ways of behaving. The phenomenon of suicide, imitative suicide, sometimes called suicide contagion, although that's a controversial term, is titled the Werther effect after this novella by Goethe, the German author, called The Sorrows of Young Werther. And this book came out in 1774. It talks about the story of Werther, who experienced unrequited love. He was romantically interested in a woman. In the end, she rejects him, and in despair, he sits at his writing desk and dies by suicide. And after the book was published, there were case reports of young men in Germany and across Europe dressing in the stereotyped clothing of Werther after being romantically rejected, sitting at their writing desk and dying by suicide. And the Werther effect, this idea of imitative suicide, is a very serious and real thing. Here I'm showing you data from the United States examining suicide rates from, you see here in these lines, from 2010 until 2013. In 2014, all the numbers look about the same until August. And what happened in August? The actor Robin Williams died by suicide. You see here this huge increase in suicide numbers, and the following year, the rates appeared to be increased the entire year. But just focused on that red jump at the end of 2014, what you see is that there were expected to be about 17,000 suicides in the United States, and instead were observed almost 19,000. This was in excess of 1,800 deaths. It was a 10% increase. That is a shocking increase in deaths. A huge, huge number, which was replicated in Canada as well as Australia. And to give you a sort of a point of comparison, the global financial crisis was only associated with a 6% increase in suicides. So we really need to be concerned about this. And this was a meta-analysis by my colleague from the Medical University of Vienna, Thomas Niederkrotenthaler. And meta-analyses just take all of the studies that we have in an area, including those 3 studies on Robin Williams, and ask, if we look at the whole literature, what do we find? And what Thomas found was that there was a 13% increase in suicides in the weeks and few months after a celebrity suicide. So this wasn't specific to Robin Williams. This happens frequently, unfortunately. However, there is good news. So that's the sort of worrisome news of the story. The good news is that human behavior, all kinds of human behavior, is imitatable. And survival and help-seeking are things that humans emulate and imitate. And so Thomas and his group postulated and coined a term called the Papagano effect, which instead of being about imitative suicide is about imitative survival. And it's named after this character in Mozart's Magic Flute, Papagano. Like Werther, he has a romantic crisis and he's about to start ending his life. But these 3 boys show up and they say, "Don't do it, Papagano. Use your magic bells." As Thomas always says, he doesn't know what magic bells are. I don't either, but it's probably some kind of a euphemism for coping strategies. And Papagano uses those coping strategies and he lives and he sings a beautiful aria. And Thomas coined that on the basis of this study, which I thank him. Thank you to Thomas Niederkrotenthaler for allowing me to use this slide in my lectures. Thomas and his group found what we find almost everywhere in this study, which is that doom and gloom stories of rising and skyrocketing suicide rates actually, when they're presented in the media, are associated with an increase in suicides. But he found something interesting, which was that in 9% of articles in the Austrian press, there was a narrative which he described as the mastery of crisis class. And here's an example of it. That's why I show this slide. I want you to see the example. My German is not great, but I'll walk you through the title. Haarsbreit, a hair's breadth, Selbstmord, from self-murder, which is one of the German words for suicide, vorbei, past. A hair's breadth from suicide, past. And it tells the story of a man named Martin, who is in a suicidal crisis. He's thinking of ending his life, but he picks up a telephone and he calls a crisis line. And you can see at the bottom the crisis line responder with the phone to their ear. And Martin calls the crisis line, he overcomes his crisis, and he gets better. And after stories with this kind of narrative came out in the Austrian press, there was a small but statistically significant drop in suicide rates. We replicated this here in Canada, again, sort of pulling our data together to imagine what might be a Werther narrative, which we defined as either celebrity suicides or non-celebrity suicides, where there was a heavy emphasis on a method of suicide, versus Papagano narratives, which were stories that involved discussions of suicide that included helpful content, but nothing about deaths or behavior. And what you see here is that there was, again, an increase in suicides after Werther narratives and a decrease in suicides after Papagano narratives. This was done by a colleague of mine, Lance Hawley, here at Sunnybrook. And then, in my view, one of the most exciting studies in the past decade, which I have a conflict because I was a co-author, but again, this is a study that was led by Thomas Niederkrotenthaler from Austria. He was looking at the Logic song. You see here in the middle Logic, who is a hip-hop artist who released a song in 2017 called 1-800-273-8255, which is the old number of the National Suicide Prevention Lifeline in the US. It still works, but now the US and Canada actually have both moved to a 988 three-digit number. But back then, that was the only number that was available for the National Crisis Line. And the song was a story of a young man who is in a suicidal crisis. He's thinking of dying by suicide, but then he picks up the phone and calls the number, and he survives, and he sings about survival. And in the month of maximum interest in this song, there were almost 10,000 more calls than expected to the National Lifeline and 245 or so fewer suicides. So again, if you tell a story of death and you present it to the whole community, you see more deaths. And if you sing a song of survival, you see more survival. We then replicated this looking at social media. This was a study looking at Twitter back when it was called Twitter, examining high authority Twitter users in our market here in the Greater Toronto area. So these would have been people like our mayor or our major sports teams or major journalists. And when they tweeted about death and sensationalized news stories, we saw increases in suicides afterwards. And when they tweeted about suicide as being undesirable, tragic, or preventable, we saw fewer suicides. And I'll give you just one example of that, which is my favorite example. This tweet is, when police found Ingrid, she wanted to end her life. One day later, she wrote this. And then when you click on the link, you get to this news article by our major public broadcaster, the CBC, who writes about these two police officers who were alerted to Ingrid's crisis by her friends, and they went and intervened. And the next day, she wrote them a letter saying, "Thank you for saving my life." And after these kinds of messages came out in Canada, we saw a decrease in suicides. Forgive a busy slide, but this is a slide to show that we engaged the media. We realized about 10 years ago that we hadn't done enough of a job of engaging with our media here in Canada. And so we started a process of a series of forums and symposia and presentations to journalists and updated guidelines to really try to get our journalists to understand that it was important to report on suicide in a healthier way, to decrease the number of unhelpful sort of elements of suicide reporting, like sensationalism or writing about suicide methods, and increasing the number of helpful things that we see in newspaper and other kinds of reports, things like crisis lines, stories of hope, how to approach people who are suicidal, and so on. And the effort, we were able to show that the effort was quite successful. The problem was it didn't necessarily make a huge dent in suicides. Suicide rates were rising after the effort. There was a trend of a decrease, but it wasn't statistically significant. And the reason for that probably has to do with the narrative, that we didn't fully get the narrative right. So here I'm showing you just a categorization of Canadian newspaper articles from our most recent years that we looked, 2020 and 2021. And we divided them into 7 different categories. Categories about suicidal behavior and deaths, stories about survival, stories about a response, some kind of societal effort to prevent suicide, a call to action, so hey, we need to do something more to prevent suicide, some kind of other negative or distressing message, a positive message that wasn't about a specific person's story of survival, and assisted suicide. And what you see here is that although our research has shown that the reporting in general includes fewer problematic elements of content and more helpful elements, when you look at the overarching narrative, we focus on survival, it's 4% or so of the articles that are about survival. You add 1 more percent if you add other positive messages. 95% of the articles are still presenting some kind of relatively negative message or some kind of problematic message. And that's probably the reason that we're not seeing the improvements in suicide rates that we were hoping for. But I don't want to leave that for you as a negative. I think we've engaged with the media. The media has done an excellent job here in Canada at trying to find a more humane and helpful way of reporting. And so I think the next step is really to replicate some of what we did and try to meet with them more and talk to them about this idea of narratives and how do we promote these narratives of survival. So in summary, I hope you understand after my talk that public messaging is really important in terms of influencing suicide deaths and also help seeking. And that's why, even though all content matters, we have to think about this overarching narrative. And specifically, we need more of these Papagano narratives of help seeking and survival. And we need to do a good job of engaging with media who are always trying to do their best. I've never had a situation, I've met with dozens, if not hundreds of media members. They want to do a good job. They have a difficult job, and we need to help them understand how to do that in a way that is the healthiest possible for our society. And I hope you understand after our discussion that it's important for us to change the narrative. It's not just that we should change the narrative, we must change the narrative. And hopefully this discussion is going to be one step in that process. So I thank you very much for your attention.
Thank you very much, Mark. You clearly showed us the power that media can have on suicide prevention and the science behind that. Let me also mention to the colleagues that are here with us that we have reached more than 1,000 participants in this webinar today. As I see some people asking questions in the chat, let me just remind you that simultaneous interpretation is available in English and Spanish. To activate translation, click on the globe icon on the bottom of your screen and choose your preferred language. Me gustaría recordarles que contamos con interpretación simultánea en inglés y español. Para activar la traducción, hagan clic en el icono del globo que se encuentra en la parte inferior de su pantalla y seleccionen el idioma de su preferencia. Our next presentation is by Dr. Hazel Othello. Dr. Othello is a forensic psychiatrist, currently the Director of Mental Health at the Ministry of Health in Trinidad and Tobago. She's responsible for overseeing the implementation of the Trinidad and Tobago National Mental Health Policy 2019 to 2024, and she serves as the chair of the Mental Health and Psychosocial Support Technical Working Group of Trinidad and Tobago. Dr. Othello, the floor is yours.
Good morning, and I will just share my screen, if I may. Good. Are you seeing my screen?
Yes. Just
great.
Yeah, perfect.
Thank you. So good morning, everyone, and it is my pleasure today to speak on the issue of our experience in Trinidad and Tobago with regard to the aspect of reporting on suicide. A little bit about our country, Trinidad and Tobago. We're a relatively small twin island republic. We have a population of less than 1.4 million people. We're a multi-ethnic, multi-religious society with a roughly 98% literacy rate. And according to the World Bank, we are classified as a high-income country where about 10% of our average total annual budget is currently allocated to health. I must add that out of that 10%, approximately 5% is allocated to mental health. Our health services are arranged in regional health authorities. We have 4 regional health authorities with leadership being provided by the Ministry of Health. We have community mental health services. We have mental health wards in general hospitals, and we still have a large psychiatric hospital in the capital city of Port of Spain, where we are working to gradually reduce the number of people who use that service. by expanding our community services. Our framework for mental health services is our national mental health policy that was approved by Cabinet in 2019. And in 2021, our suicide prevention plan was also approved. With specific regard to the issue of suicide, we have to look for a little, just briefly, at our mortality rate, which has been gradually going down over the past decade, as you can see in this slide. So in 2021, our rate was about 11 per 100,000, and the last reported number was 8.3. Unfortunately, from 2020 to 2023 has not yet been published. And as a result of that, we don't know exactly what the prevalence did during the years of the pandemic. So although intuitively we would anticipate that it may have gone up based on experiences and reports and things like that, we don't have the data for that just yet. Using the WHO data portal, we can see that in 2000, Trinidad and Tobago was third in Latin America and the Caribbean with respect to our suicide prevalence. And by 2019, we were out of the red and into the orange zone. So we have made some progress over the years. The most commonly used method of suicide in Trinidad and Tobago right now is hanging. For many years, it was ingestion of pesticides, particularly a pesticide known as gramoxone, more commonly known as paraquat. However, that is no longer easily available, and unfortunately, it's been replaced by hanging, which is a method, as you know, where removing things that you can use to hang yourself is not as easy as removing a toxic substance from the market. So in Trinidad and Tobago, we have been looking at the issue of suicide and looking at ways to reduce the prevalence. We have been looking for evidence-based methods, and we have been participating in the Live Life project. As a result of that, we became aware of the importance of journalists, since they play such a big role in shaping the national discourse on a wide range of topics, including suicide. So we decided to engage with our press in order to reduce the prevalence of suicide in Trinidad and Tobago through improving the quality of the reporting. And we actually had a workshop where we met with them, discussed with them, and I will talk a little bit more about that in a little while. But I just want to bring your attention this quotation from one of our journalists, where she says we should provide the facts, not make speculation, not sensationalize. Let people know that there are signs that indicate suicidal behavior and help them identify those warning signs and offer advice on asking for help. This slide shows you some of the unfortunate articles that appeared in our journalism before we began that intervention with the press. And as you would notice from these headlines, they are sensational. People are identified by picture, methods are emphasized. In some cases, unfortunately, people were named in a way that was not particularly helpful. And as in one slide, the fire in which someone ended their life by setting themselves on fire was actually highlighted in a photograph in the newspapers. So we knew that we had a big job ahead of us if we were to address this issue. And in 2017, we held a workshop with members of our media houses where we discussed with them what we thought was important and had dialogue, worked with them to develop guidelines. We didn't impose something on them. We worked to develop them together. These guidelines were formally launched in 2018, as well as the introduction of a monitoring tool that would be used going forward to monitor the level of adherence to these guidelines by our local media practitioners. So what did we do? Very simple method using Excel spreadsheets. We've looked at the print reports, digital reports, any new media reporting over the following years for references to death by suicide, death by murder, suicide, attempted suicide, any references to self-harm or general discussions on suicide or self-harm. We looked in both paper-based and electronic media. We used Google Alerts to help us to find these articles, and we began a process of documenting and prepared reports every 6 months, and both of which will be combined into an annual report at the end of each year, where we cataloged what was happening so that we could look at the trends. And this allowed us to respond to information requests from members of the press or other agencies who want to know what's happening in this area. This slide shows you the guidelines that were produced as a result of that collaboration. It's now on the Ministry of Health's website so that members of the press in Trinidad and Tobago can refer to it at any time should they so wish and be guided in terms of better ways of reporting on suicide. So it shows the main ideas similar to the ones that were mentioned earlier by Mark about not being too sensational, not highlighting methods, not highlighting where it took place and what took place and the contents of a suicide note and things like that, and instead focusing on messages of hope and directing people to where they can receive care if they are having thoughts about harming themselves or ending their lives. And as a result of that, you would see a more recent article where instead of saying something sensational, it simply says Malabar woman dies by suicide. And it points people to helplines where they could receive assistance if they are having thoughts of ending their life or harming themselves in other ways. In addition to these helplines, we also have on the Ministry of Health's website the contact information for a number of other agencies that are a part of our mental health and psychosocial support network, so that even someone who's not suicidal, but who is in some kind of emotional or psychosocial crisis can reach out and receive support before they get to the point of contemplating ending their lives. This slide gives you an indication of the output of our monitoring and evaluation tool, and it shows for 2022 and 2023 what types of issues were seen with regard to adherence to those guidelines. In our current already published reports, we use the word violations, but we're moving away from that because we want our language to be more collaborative with the press, and we don't want the press to feel that we are judging them in a negative way. So future reports will not use the word violations, but this is what currently exists. So you see locations, failure of adherence with regard to locations and methods and things like that are highlighted, and you would see that in 2023 the numbers started to go up again. So that made us very aware that there was much more work to be done. Persons who worked in the press in 2017 when we began our original collaboration may have moved on. Reporters on the ground at that time may have been promoted and moved out of the newsroom new people in the industry may not have been aware of these guidelines, and we realized that we needed to do more to ensure that this would continue to be adhered to. And as a result of that, we decided to have a refresher training activity so that we could bring more people up to speed. So actually this took place last Friday on the 6th of September 2024, where we met with representatives of our media for that refresher training workshop so that we could build consensus, talk about the guidelines, so hear their thoughts with regard to the guidelines and their suggestions, share with them our thoughts on adhering to the guidelines. And one of the other things that we have realized that we need to do is update our monitoring and evaluation methodology, because it's becoming a bit too much for just an Excel spreadsheet. So we're in the process of trying to obtain software that would make that process easier. And this is a picture that actually shows us the workshop that we had last week. Our local PAHO WHO representative, Dr. Gabriesus, was with us. Dr. Harris also spoke. Some of our members of the team presented, and as you would see, a number of journalists participated, and it was really encouraging because the journalists were enthusiastic. They shared the sentiment that they wanted to improve the way things are done. They shared with us the challenges that they face as journalists, the competing priorities in the newsroom and things like that. They shared with us the fact that we have to start thinking about how we can better engage with social media activists, because while they may be doing things one way in the newsroom, you know, the bloggers out there and the other informal the persons who contribute to the local discourse in informal ways are not aware of these guidelines and often share things in a very unfortunate way. So that was really, really an exciting and encouraging collaboration, and we look forward to ongoing collaboration. Many of them requested that members of our team come on their radio stations and so on to share this kind of information with the general public. So we look forward to increasing that dialogue. And with that, I bring my presentation to an end. And at the appropriate time, I will take your questions and comments. Thank you for your kind attention.
Thanks to you, Dr. Othello. Thank you so much for your presentation. The experiences of Trinidad and Tobago are very important to be highlighted. The country has made important progress with the implementation of public health measures to prevent suicide, and especially what you just showed us, the work with the media and how impactful it can be. Thanks for sharing those experiences from Trinidad and Tobago. I think it's very useful for the whole region of the Americas. Ahora pasaré al español para presentar a nuestra última
Now I'm going to
ponente,
switch to
que es la
Spanish
doctora
to present
Fernanda
our last speaker,
Hernandez.
who is Dr.
Doctora
Fernanda
Hernandez
Hernandez.
es
Dr.
médica de la
Hernandez
Universidad Militar de Nueva Granada,
is a
especialista en
doctor at
epidemiología,
the Military
magíster en
University of
Administración en Salud
Nueva
por la
Granada,
Universidad del Rosario.
and she is
Se
also
desempeña
from the
como editora
University
y
of
presentadora de la
Rosario.
sección
She
de
is a
salud
speaker
de
in
Noticias
the health
Caracol de
section
Colombia.
at the Caracol
Adelante, por
News
favor, doctora
program in
Hernandez.
Colombia. You have the floor, Dr. Fernanda Hernandez. There's no
Creo que está
sound.
muteada, doctora.
I
O hay
think
algún
you're
problema
on
ahí en la
mute, or we
presentación.
have an audio problem.
¿Me escuchan?
Can you hear me now?
Ahora está
¿Ahí
perfecto.
me escuchan?
Yes, now we hear you.
Hola, muy buenos
All
días para
right, thank you,
todos.
and a very good
Muchísimas
morning to
gracias
everyone,
a la
and thank
OPS
you very much to
por esta
PAHO
invitación
for inviting me to speak today, and particularly for having this very important program. And I wish to thank everyone who is connected right now, because without a doubt, I am convinced. I hope you're seeing my screen right now.
Sí, está perfecto.
Yes, it's showing perfectly. Thank you very much. I am convinced that these kinds of programs, in addition to raising awareness and concerns and bringing us to reflect on things, they spurs us to action. And under the topic that brings us here today, each and every one of us and the people with whom we are going to share the information can literally share this and save lives. This is not something that psychiatrists, therapists, and social workers need to work on. They see a very small percentage of the cases. So we are convinced that we have a shared responsibility. We have to be the front line of defense as friends, family members, and community members, and we can take a great step forward. So I thank all of you for your interest, your time, and for being with us today, particularly when we have this shared responsibility. When I say that, it is because we see the need to change the narrative. And once we have this on the table, it's not just changing the narrative. We also need to think about who are the narrators, who's telling that story. We're going through a very challenging moment, quite complex. On the one hand, we have a well-documented situation in which there is a tremendous increase in mental health issues on a global scale. And in addition to this, we have a major transformation underway. We're at a time in which the way that we consume and access information, although the speed and quantity of information and the quality of information, we don't have to look very far to see how our own families our own family members are getting information in different ways. A young person might be getting their information from a platform like TikTok, and a young adult might be getting their information through X or Instagram, and older people are probably getting their information through conventional media, radio and press, and platforms such as Facebook. So this fragmentation of sources of information is a major challenge to everyone. And for this reason, we do need to have urgent action because of this major transformation in the way that we get information that affects not only mental health and suicide, but information and health in general. Just 8 years ago, or 18 years ago, talking about suicide, we're talking about what it was all a major challenge. Now, almost 2 decades later, I confess that this continues to be a challenge. I would even go so far as to say it's a much greater challenge, and I'm going to explain why. It is a challenge due to many factors. I'm going to share, we don't have objective data to tell you which media out of 10, 8 share certain content with images and everything, but this is essentially what I have seen over the course of my career. If we look at 15 years back, it was I did a search, there was much less. And this year, let's say there are 3 reports, for example, what we see today, it's 3 reports just for August. We know and are clear that the media bears a tremendous responsibility when communicating on these topics. Why? First, we could send a message that inspires hope, that helps, but there could be another side of the coin in terms of how we handle information. And on the contrary, we might, for example, perpetuate errors and stigma. So this difference might happen with very small details. So we're not just looking at language and words that we use with incomplete or incorrect coverage, but also with images. So sometimes we tend to show sensationalist faces and tragedy. Sometimes there's some very interesting phenomena to look at. Sometimes we can even sit down to analyze when there are time constraints and pressure and meeting a deadline. And so we might have the most suitable images available. So the focus and context provided to the subject tends to oversimplify the causes and explanations surrounding a suicide. So we need to be very careful with each detail. I'm just talking about with the conventional media, TV, which is where I work specifically. So we should take care not only with the content, but also the way that we tell the story. And outside of this, there's this is a very complex issue. And sometimes things, we say it's inexplicable, but the opposite is true. There is multiple factors involved, many sides to the story. There's social, it has to do with religious aspects. So trying to explain such a complex phenomenon has to bear in mind the content, the context, and that is much more challenging. And in addition, when we have a complex phenomenon that we are going to communicate to a population that has their own perceptions, which may not be very appropriate, and there's a major challenge, and you try to explain what is not seen, like emotional problems, then you can have an idea of how many challenges we face in trying to communicate about mental health issues leading to suicide. So then we have to see who covers this subject. It's not just journalists in the area of health whom we would hope would have some training that goes into discussing these topics, because furthermore, mental health issues and suicide is cross-cutting. You might find this in sports. It's something you don't find with other subjects. So we need to train, we need to give people literacy in communication about suicide. That means to say all journalists should be trained in this. And when we think about these images, we need to also think with people who are in charge of the file, who are in charge of graphics, people in charge of editing. Journalism produces a product with the input of many people. So without a doubt, this is where we begin to realize that we have a debt in the conventional media. And for example, we're not talking about messages because messages are coming from many sources, not only news programs or conventional news sources, but also through ads, through literature, through cinema, for example. So we need to be aware of this. We need to work with publicists, with text writers, and we see that this challenge really is great because we also, as the professor said, we're looking at the contagion phenomenon and imitation. So all of this points to a tremendous responsibility. And I was talking about some 19 years ago, the decision might be, well, let's not address this subject unless it's an extremely high-profile case. And in this case, we might give some figures of context and general recommendations, but not go into depth. So this again, we have to see how superficial our coverage should be. And so once that was what was happening a few years ago, when consumers were passive and only got information from the television, radio, and the written press. Today, we have a totally different situation. As I said at the beginning, everyone in a family is learning about the world from different sources of information, and they all may be left with completely different impressions of what is going on. But in addition, we not only receive the information from different sources, now each and every one of us, anyone who has a smartphone, can become producers, editors, and disseminators of information. And so this is a true tsunami of news, data, information, opinions, facts. And I'm not trying to say that these are all ill-intended or poor quality. No, on the contrary, there's often excellent content that helps us, that offer guidance and empathy. However, we also know that there are tremendous challenges because there are no quality filters in terms of who is sending and who is receiving the information. And so that is the reality of the situation. And on a daily basis, we see how social media frames these conversations, which conventional media cannot be removed from. So I would like to bring into the conversation two cases that we have experienced over the last couple of months here in Colombia that had to do with the suicide of two university students. And they went viral, and it became a top of daily conversation, and they still are today, because this is an effect that lasts for some time. And when we look at the recommendations, we know that we do not advise that you show their means of suicide methods. And we also see, as a conventional media, that we're all clear on this, but then we have been thinking about, but if the methods and suicide notes are posted all over social media, and some people are getting it through their WhatsApp. I often get this information through WhatsApp. So this is where perhaps we should be thinking about having a plan B, a plan C. How do we address this new reality, and how do we respond to these new challenges? So the question is, for example, how do we handle what's already gone viral? And how can we talk about these very specific topics that we didn't recommend before? So you might see this and reflect on what we should do, because this is what's happening right now. And that's why we need to have these new narratives that we've talked about. But it's not just the narrative, but it's also who's presenting the narrative, who is the narrator. So sometimes the messenger is as important as the message itself. I put up the Pope here because during the pandemic, the image of him putting on a face mask was so important. And many people who weren't sure that they should wear a face mask. And we had experts from different areas of science and public health talking about this, but we felt we had to look beyond to other influencers and people who might really bring the message home. And so we know that the challenges are great, and through conventional media, we're trying to stay on top of all of this. We need to have suicide literacy, not only for journalists, but for everyone who shares these messages. And now we must also have literacy for the community. We have to look at the contagion curve, like we did with COVID. We have to look at the contagion curve with the infodemia. And we have to look at the digital world and how this impacts mental health. So we need to work with communities, with leaders, with people that the public follows. And we have to look at these new influencers in these new roles. It is extremely important for us to work work with social media platforms. These platforms must look out for the quality of the information. We also have more than enough evidence about what happened, for example, during the pandemic, and how certain information was perpetuated. There wasn't enough control about the quality of the information, and it made our work much harder when working with the communities. It is also very important for us to work with patients and families. For example, there are studies in Spain that show that just 3% of journalists have that voice. Who is speaking for those who really should speak? There are other people and are speaking for them. And maybe we are making visible what is not reality, while the day-to-day experiences are remaining invisible. And we have some mistaken perceptions in society. So we need to look at the storytellers. We need to look at health professionals first, so that they can get involved in showing how important it is to share information, and they should become the influencers, because it has also been shown that health professionals are the first people that individuals seek out when they want to get health information, because they have credibility and knowledge. And so they've already got all of that in their favor, and they could become influencers. Obviously, we also need to get away from technical language and the formal language that pushes people away. We need to hear what people, what questions people are asking. There's a very simple one to say, could you identify the needs for information of people? And for example, we see that there's tremendous fear amongst professionals who work in mental health. We see that there is a tremendous need to delve further into treatment, because people are very afraid. They don't want to be doped up. They don't want to be medicated. They always look for natural alternatives for handling their conditions. So there is a great need of information, and this requires focusing on other kinds of information. So it's hard work, but we really need to do so. And this is part of changing the narrative. And also with the health professionals, we need to have greater literacy of our other colleagues. We're talking about the skills of psychologists and psychiatrists. It can be very painful when we look at the statistics and realize that 4 out of every 10 people have had contact with a health professional months before their attempted suicide. So how did we not realize this? How did we not get this on our radar? How did we not see the signs? So we see all these opportunities. We need to have a regular approach to this. We only shouldn't think about suicide prevention on September 10th, or when a famous person dies this way. We really should focus on this all the time. We should be looking at other issues, and we need to make mental health a priority, not only for health workers, but for politicians, for the finance ministry, and make sure that people have access to treatment, to appointments, and overcome obstacles in the workplace. So we need to have a broader view, and we need to act ethically and responsibly. And just like with vaccine preventable diseases, we need to make sure everybody gets the treatment that they need. And we should see this depression as a condition that can be managed and that affects their quality of life. This might help many people seek early help in time, and allow them to not get to the point where they see no solution to their situation. As I said before, we would be allowing people with mental health conditions to be more visible, and we should focus attention on mental health disorders. Out of every 10 cases of suicide, there are 8 people who have needed mental health care. So we need to expand and share the recommendations through all of those narrators I talked about. And it's day-to-day work, and we need to get beyond the immediate things where we're bombarded with information.
It would be wonderful if we had an observatory to clarify all these events that one could bring from other studies or other observatories that might be seeing the same, but it would be so interesting if we could have clear diagnoses so that we could have clear interventions and do the follow-up and truly take communications seriously, because it's a fundamental tool that we have. Aside from the fact that there is a real need for information from the people, if this is a very simple exercise that you find in Google Trends about suicides in the last 12 months in my country, this is the interest, the popularity of the issue. And that means that it has certain peaks which coincides with the visibility or the viral nature. We have diagnosis to focus, for example, on zones or areas or regions where there's greater interest or where the topic is more popular, and we can see what people are asking about. We have consultations about depression or anxiety, which have practically tripled. There are studies that show us that from 2015 to 2020, there was a threefold increase in depression. So there's a real need. And I can tell you from the bottom of my heart, the mass media are not enough to give that information. Today, I'll go on the air with a 3-minute report on suicide prevention, but the people need to have more information. And if there was one thing that we learned from the pandemic, is that communication is the mother of all pharmacologic strategies. So we have to work together. We have to work in a solidary manner. We need the leadership, and we're just one little piece of the whole thing. And hopefully we could harmonize this with the community leaders, with the authorities and messages, with the other media. And we must bear in mind that we are facing challenges, not just the few I mentioned, but for example, things like how are we going to focus our work? How are we going to regulate our work of artificial intelligence so that it becomes an ally when communicating responsibly and ethically and conveying that hopeful message about mental health so that the message is reinforced and we not take steps backwards. So we're calling on all of you, as it says, keep calm and communicate, and let's save lives, because we can achieve that all together. Thank you.
Muchas gracias, doctora
Thank you, Dr.
Hernández.
Hernandez.
Gracias por
And
traer a
thank you for
nosotros
bringing us
la complejidad y
the
también los aspectos más
complexity
específicos
and the
sobre
specific
las redes
aspect of
sociales,
these
la importancia de
social
reflexión
networks, the
y acción
reflections, the needs
dinámica
for dynamic
y
action
rápida,
and
incluso
rapid action,
la
and
alfabetización
even the
digital. Son
literacy,
aspectos
the
muy,
digital
muy
literacy, which are
importantes,
such
muy
important aspects,
actuales,
which are
y
very much
espero
up to
que
date.
los colegas que
And
están
hopefully the
acá con
colleagues who are
nosotros
here with us
también
today
aprovechar
will
el
also
conocimiento
take
que
advantage
usted
of
ha
the knowledge
compartido
that you've shared with
con
us.
nosotros. Colleagues, we have received many questions and comments. We also have used this opportunity to share documents and material that we have available at the Pan American Health Organization, documents that are available in English and Spanish. I have a few questions here. Obviously, we are not able to go through all of the questions, but I think we can try to answer questions that can be very important for the audience to listen to the perspectives of our panelists. Mark, I have a question here. It is about the theme, changing the narrative. Our colleague asks if this is changing the narrative is something only for media, or changing the narrative is also about schools, universities, work environment. How do you see that?
Yes, it's a great question, and I think the answer is yes. It should be for all of those environments. The purpose of changing the narrative in the media is just because the media has a wide reach, and we really want everyone in society to understand a different narrative. But to the point that the questioner is making, there are many other opportunities to do that. The only caveat that I would put out there is that we have to be cautious about having too much media on suicide in general. We don't want to inundate our public about suicide constantly. In fact, we have evidence that doing that is probably quite harmful. So the idea would be very sort of brief, targeted, but also really helpful information provided by the media, but by these other groups as well. And I had forgot to mention in my talk, but I will put it up in the chat, that the Lancet Public Health just put out a series on suicide and has a really nice article on public health approaches to transmissibility of suicide that covers this in great detail.
Thank you very much, Mark. Thanks for sharing that with us. We have another question here. Hazel, I think this question is very connected to your presentation. Would you have working material, documents, or guidance that has been used in Trinidad and Tobago, and it can be used also in other countries to train journalists about the themes that we have been discussing here? You mentioned that you have been running some training in Trinidad and Tobago.
Oh, thank you for that question. We do not have any locally generated literature to share at this time. However, we have relied on evidence from PAHO publications in our training and other resources that we have found from reliable sources, universities, and so on, to guide our training process. But a big part of our training was collaboration with the press, because we realized that you could provide as much information as you want to. If they feel that, at least what has come across to us is that if the press feels bombarded and they feel as though they were being instructed by the health authorities, there's going to be pushback. So that our guidelines that we developed, that we now have on the Ministry of Health's website, are guidelines that were developed in collaboration with the press and that were further discussed with the press at our recent workshop.
Great, thanks for sharing that, Hazel. I think the term collaboration here is essential. I have been following up the work that you do in Trinidad and Tobago, I think, and I really believe that this is the essence. Is working together, is finding ways that we get a common language and a common approach, and that's probably one of the main reasons of your very successful results in Trinidad and Tobago. Doctora Fernanda Hernández, hay una pregunta acá.
Dr. Fernanda Hernandez.
La persona menciona que hay una
We have a
serie que
question where
estuvo en
the person
plataformas de
speaks of a
TV
series of
que habla
TV
sobre el
platforms
suicidio
that speaks
en
of suicide
jóvenes y
amongst
lo
the youth.
explica de manera
And it
muy
explains it
cruda, pero
very
realista.
cruelly, but very
Pero se menciona
realistically.
también que al final
But
de
it
cada
also mentions that
capítulo
at the end of
indican
each
un número
chapter,
para
they
llamar por
send a
ayuda
number
y
that
en
they
caso de
can
conocer o
call in
saber de
case of
alguien que
needing help,
tenga
and that if anyone knows of
pensamientos de
anyone who may
suicidio.
need because they
Y la
have
persona
suicide thoughts or what
pregunta,
have you, they give that number.
¿usted cree
And the
que este
person
tipo de
asks, do
programa
you
es
think that
bueno?
programs like these are good?
La información que
The
transmiten
information it
puede
conveys
ayudar a
would help
prevenir el
prevent
suicidio.
suicide?
¿Y cuál sería su
What's
opinión
your
sobre
opinion
esto?
about that?
Renato, gracias por la
Renato,
pregunta.
thanks for
No
the question.
conozco la
I
serie,
don't know
pero
what series they're
definitivamente, como
talking
les
about, but
decía, no
I can tell you
solamente
that,
estamos
as I
transmitiendo
mentioned, we're not only
información o
conveying
alfabetizando desde los medios masivos,
information or
realmente la información es
teaching through the
ilimitada.
media because the
Entonces,
information that we
sí
have
son
is quite limited.
necesarios
But
otros
yes,
espacios.
we have to
Por
use other
ejemplo, yo
spaces
recuerdo
as well.
que aquí hubo una
I
novela
recall,
muy
for example, that
famosa
there was a very
y
famous
estoy segura de que la
soap
gente
opera
aprendió
here.
muchísimo
And I'm
de
sure that
ciertos
people
temas de
learned a
salud de
lot
enfermedades
about
crónicas solo
some of the
por
chronic
los libretos
diseases
que se
and the health
manejaban
issues because of the
dentro de ese
scripts scripts that were used in that soap opera. So yes, I think they're very helpful. The approach of whether it's cruel or not, it's just a question of style. But if the message is making awareness of people that we can all contribute to a change, that we can all see it not something that can happen to others, but it could happen to everyone at different ages and with different explanations, that can be very helpful. To speak of and show the people the different lines of help is very important. In fact, it's amongst the recommendations. Whenever we speak of suicide prevention, we must be able to give the people tools of where they can communicate, who else they can talk to, showing them that there are many help tools. Access to a professional is not always that easy. And that first line of contact could be maybe through a phone call, because today I believe that all our countries have a lot of different, very valuable initiatives that are helping us make people aware of the situation, to listen, which is something so important in mental health, to listen more than to speak.
Perfecto. Muchísimas gracias,
Perfect. Thank you very much,
Mark,
Fernanda. Mark?
please.
I wonder if I could just add, because I was
Never-
involved in some of the studies of the series that they're discussing, and it's complicated, but I think that the conclusion is these things are harmful, and the reason they're harmful is it comes back to the original question of what the theme of Suicide Prevention Day is, which is changing the message. What's the message? If you have a show or a news article or any kind of presentation which shows suicide as inevitable, walks people through how to die by suicide, shows help seeking as being useless, which happened in this instance, and then at the end writes a crisis line, it doesn't solve the problem, because the message is still a harmful message. It's not that, if such a message exists, it's not that one shouldn't add a crisis line that might slightly make it a little bit less harmful. But what you're doing is taking something very harmful and trying to make it a little less harmful. What we're trying to do here is to do something helpful. And helpful would be sending the opposite messages, that there's no reason that anyone has to die by suicide, that, not showing people how to do that, but showing people how to seek help and showing how help is effective. Those are really the messages that we need to put out.
Thank you very much, Mark, for complimenting that. There are quite a few more questions here, but when I go through the questions, I think many of them have been addressed through your presentations already. Let me then ask a question to the three of you. It's a question that someone also sent us. If you would leave us with one message about how to provide hope, how to say something that can really help the community on suicide prevention, what would be that key message? Perhaps we start with you, Mark.
Oh, I'd like to do two, but okay, I'll start. If I only have one, I think that the main message is people who are suicidal feel separate. They feel stuck. And so what we need to message is something that is opposite to that, because that isn't true. And so it has to be a message about the idea that there are other options, and in particular that people who are suicidal, like everybody, are loved and belong and matter in society. And if we can convey that message, we will certainly reduce many, many suicides.
Thank you very much, Mark. Hazel, your message.
My message would be to the general public, and it would be advocating for simply listening and being there, basically good old-fashioned being your brother's keeper, so that when somebody, or if someone feels hopeless, you can be that beacon of hope, not by trying to be a mental health professional for them, but by just letting them know that they're not alone and that help is available, and present to them, as Mark said, the fact that there are options.
Thank you so much, Hazel. Thank you so much. Fernanda, tu mensaje,
Bueno,
por
Renato,
favor.
yo
Fernanda,
iba a
what's your
hacer
message?
énfasis
All right,
en
Renato,
escuchar,
I would
entonces quiero
emphasize
decir, creerle a las
listening,
personas.
but I think
Cuando
we also
alguien
need to
dice,
believe people.
estoy
When someone
aburrido de
tells you,
vivir,
I'm tired of living, or uses expression like, I wish I could fall asleep and never wake up. I wish I could disappear. We should sound the alarms. We need to delve deeper and not make comments like, no, don't worry, don't say things like that, or forget about it. There is an expression from psychiatrists that I like very much, which is, a dog that barks does bite. We aren't psychiatrists, we aren't experts, but we can pay attention, raise the alarm, and support that person. Maybe I can't do everything, but I could help you look for help, and that makes a difference.
Thank you so much for your very strong messages of hope. We are now coming to the end of today's webinar. Let me again thank you, Dr. Sinyor, Dr. Othello, Dr. Hernandez, for really taking the time to share your expertise in this very important topic. Let me again thank the University of Toronto for the partnership and the collaboration in this webinar series on changing the narrative for suicide prevention. We really look forward to seeing you, all of you, at the next webinar. We'll be sharing more information on the next webinars soon. While today's webinar highlighted the role of media in changing the narrative, all of us, individuals, organizations, communities, and governments have a part to play. We at PAHO, we are really committed to supporting countries in the region to advance suicide prevention through effective, evidence-based strategies. We are sure that working together, we can prevent suicide. And please remember, if you or someone you know is in crisis, please seek help from someone that you trust, from a health professional, or contact your local helpline. Thank you so much, and have a nice day.
Take care, everyone. Thank you.
Gracias.
Bye.